West African Health Organization under the Regional COVID-19 Response Project financed by African Development Bank have extended a monumental gesture towards Gambia government, donating a fleet of 10 ambulances, 2 Toyota Prados Land Cruisers, medical laboratory information communication technology equipment to the Ministry of Health. The landmark event convened at the I-22nd Memorial in Banjul that drew together senior government officials, cabinet ministers, representatives from international organizations and development partners. Delivering keynote address, Vice President Mohamed B.S. Jallo described the ceremony as a testament of regional solidarity and strategic partnership, adding that it further consolidates institutional and the government collective effort in addressing most fundamental challenges in the sub-region.
That ECOWAS member states and their partners can deliver results that directly improve the lives of ordinary citizens. Today, we are handing over a fleet of modern ambulances and critical medical items, including ventilators, concentrators, and their accessories, monitors, X-ray machines, anesthetic machines, hemodialysis machines, diagnostic tools, biomedical engineering tools, and many more. This is a direct response to a critical need. Rural and remote communities continue to transport ill family members to health facilities. These ambulances will now be deployed in communities to serve as vessels of hope. These items will strengthen our ability to respond to emergencies, ranging from road traffic accidents to obstetric complications and infectious disease outbreaks. The items will reinforce the primary healthcare system, which underpins our national health agenda.
Minister of Health Dr. Amadou Lamin Samate says the ministry has never been donated with a magnitude of equipments at a time. We have never had such a donation ambulances from any institution with this large number at once.
The partnership between Waho and the Ministry of Health has been long-standing. Waho has been very, very supportive when it comes to capacity building, training within and outside the country. In fact, Waho has been our most active partner when it comes to training of our people throughout the region. And I think they deserve a big round of applause for that. From the laboratories to the surveillance units to all cadres of staff, Waho has been there. Hardly does a month go by that Waho doesn't send invitations for capacity building for our people. We thank them very much. Today marks another very important day because today happens to be the anniversary celebration of Waho. But Your Excellency, for your information, to the best of my knowledge, we've never had such a donation of ambulances from any institution in this large number at once.
Dr. Omar Aliou Toure, President of the ECOWAS Commission, said the donation marked a major achievement in the institutional partners' collective journey towards regional health security. He called for protection and sustainability of the investment for the Gambia people and future generations.
Here are the investments made here are investments in the resilience of our people. We are profoundly grateful for the partnership of the African Development Bank, whose vision and support have been instrumental. Under this project, we have seen remarkable progress. A total of 1,427 health professionals have been trained. 55 points of entry have been equipped, and thousands of sets of personal protective equipment have been procured. Today's handover of 10 ambulances, along with essential biomedical equipment such as oxygen concentrators, hemodialysis machines, and X-ray units, will significantly strengthen emergency care, diagnostic and specialized clinical services across the Gambia. This support will immediately improve the quality of care and timely access to life-saving services for most vulnerable populations in the Gambia. It is a direct contribution to improving the quality of life for our citizens, which is a core priority for our community. As a Gambian, I'm particularly proud of the remarkable achievement of my home country under this project. The Gambia has achieved 100% physical completion rate for its programmed interventions, demonstrating strong national ownership and effective coordination. Between 2024 and 2025, 852 health workers and stakeholders were trained in integrated disease surveillance and response, incident management systems, infection prevention and control, and other critical areas. This reflects the commitment of the Gambian government and its people to building a resilient health system for future generations. For the health workers, the communities and the leadership of the Gambia, we salute you. Your dedication is an example for the entire region. Distinguished ladies and gentlemen, this project is a cornerstone of our broader strategy to build the ECOWAS of the future today. We must not see this as an end, but as a beginning. Our region continues to face serious health challenges, from emerging infectious diseases to the burden of non-communicable diseases. The lessons from this pandemic and the infrastructure we have built must guide our path forward. I commend the government of the Gambia for its strong ownership and effective coordination, which have been critical to the project's success. We look forward to deepening the collaboration. ECOWAS, through the Waho and in close partnership with institutions like the African Development Bank, will continue to invest in our regional health security. As we receive these materials and equipment today, let us remember that they represent more than just tools. They represent hope, resilience, and our shared commitment to protecting the lives and dignity of every West African. The ambulances will save lives, the oxygen concentrators will support critical care, and the diagnostic equipment will ensure that no Gambian has to travel far for essential services. This project is a shining example of what we can achieve when the African Development Bank and ECOWAS and member states unite in a common purpose. It is a model that should inspire our future investment in regional health security. On behalf of the entire ECOWAS institutions,
I am Abdullah Defe reporting the Voice Online TV.